Welcome. My name is Michael Lucido, and I'm a physical therapist, and I am a teacher and instructor with the North American Institute of Orthopedic Manual Therapy, also known as NAIOMT. Today I'm doing a series of videos that will primarily be used for our online education. And I'm using these videos, as I call these, the best of NAIOMT, the best of the North American Institute of Orthopedic Manual Therapy, giving you a taste of some of our different theory and practice that would then give you a sense of where we're going as an institute and whether you'd like to join us or not. Another technique, as well as the practice and theory of NAIOMT, and we're titling it some of the best techniques of NAIOMT of the upper quadrant, is at the elbow. And the reason we like this one because it is a problem that many people who have elbow pain actually have a biomechanical restriction of the elbow, and our assessment leads us right to the problem, and the treatment can be literally curative if it's delivered at the right speed for the right patient and the right amplitude. So we're going to take a look at Luke's left elbow. Let's say that he's got a chronic lateral epicondylitis. I'm going to move over to the left elbow, and one of the things we actually do after we do a general peripheral joint screen is take a look at the biomechanical function of the elbow itself. And what the elbow actually does, besides preparing us to feed ourselves or to have functional movements such as this, it actually has to have a bit of a glide of the ulna on the humerus. So the ulna is sitting like this, it's concave, and it actually has to glide medial and laterally in order to have full elbow function. And during our courses, we teach you how to do this assessment. So one of the techniques we can actually do with the elbow that's experiencing lateral elbow pain, but actually appears to be more of an etiology of biomechanical dysfunction, is mobilize the elbow. And we like to do that with movement. So I'm going to place my left hand on the ulna. I'm going to stabilize the humerus with my right hand. And what we're going to do is we're going to mobilize the ulna medial to lateral in the direction of my thumb as Luke bends his hand towards his mouth. So here we go. Just like he is with the functional movement as he is feeding himself, and I apply medial to lateral mobilization as he does that. Again, fixing with my right hand and mobilizing with movement with my left hand. That's one very, very effective technique. The other technique is what's called Manipulative Technique, and we're going to provide the same force to the ulna, but we're going to do it with a high velocity, low amplitude force to the ulna. And we do this because when the mobilization doesn't work, it actually may respond better to a higher speed technique. So we're going to place the shoulder out into 90 degrees of abduction. He's nice and relaxed in that position. We then come into the medial part of the ulna with our metacarpophalangeal joint of our left hand. We're going to place the elbow just slightly out of extension. The forearm is in slight supination, and we're going to provide a manipulative thrust of the ulna going in this direction. So this is correcting what's called the abducted ulna. So this is going to be set up just like this. The patient's nice and relaxed. We're going to do a little pre-manipulative hold to make sure he tolerates that well, which he does, and then come in with a nice thrust in that position. This is what is known as the abducted ulna. It can produce many symptoms from medial lateral elbow pain or wrist problems as well, and it's one of the better techniques we show in our courses.